So basically, I'm going to ask you a couple of questions about your surgery. So how many weeks today, Joanne, are you after your procedure?
6 weeks.
You're
yesterday.
6 weeks.
Mm-hmm.
Well, can you tell me what I did on you? Do you remember?
Yes,
or like now that you have no pain, you
absolutely. You did a bone spur on my right foot.
And it was on your big toe, right? Yes. So you actually had arthritis in your big toe.
Right.
And you're very active and you exercise, and it was really preventing you from doing what you enjoy doing, right?
Yes, because I was running and I couldn't run. It was hurting me every day.
And you and your other podiatrist tried the cortisone injections, and it really didn't work. And so we decided to go in, clean out the joint, and remove all the spurs. And obviously, I gave you the option of fusion, and I gave you an option of a toe implant, but we kind of decided.
Neither one of those were an option.
Well, I think not yet, right?
They were older, maybe, and I didn't. Yeah. But my point of doing this was to get my full range of motion.
Exactly.
Without pain.
Exactly. So basically, you're 6 weeks after the surgery, and you were just telling me about your workout yesterday. You did. Which was with CrossFit and pretty intense.
Right, yes, it's the first time that I attempted my jump roping. But we do what's called double unders that you double time. And I did, I don't know, a couple hundred of them. and it didn't hurt. It felt great.
6 weeks after the surgery.
Yeah, it didn't hurt. It felt great. And of course, I had a little swelling last night, which I think's normal because of all that. And I put ice on it. And I mean, it didn't hurt.
So, are you happy you had the surgery?
Oh, absolutely.
Good,
yes.
Good. So for people who like live in pain and they suffer and they like, oh my God, I'll never have surgery, last resort, what would you recommend?
I recommend doing the surgery 100%.
I'm with you. I mean, you've done so great.
And it's wonderful. I mean, you know, after I'd say 2 weeks, I really was doing great. Happy without the boot, and every week it's a big difference. I mean,
right, and I remember I told you that medicine improves all the time, which basically means that probably in a couple of years, if something needs to be done again, they probably will have some kind of artificial cartilage that we can implant or something of newer texture, because unfortunately with implants, big toe implants, we really don't see more than maybe 10 years, and then you have to replace it. So in somebody who is very sedentary, and you are not, you know, I would put an implant in, but with you it would probably wear out in a matter of 2 years. And in fact, actually, I just did surgery on somebody who was in this type of situation. And it was very unfortunate because I didn't put the implant in. I never would on a young person. And we ended up having to fuse the joint just because of not the correct procedure being chosen for that patient. So, well, you did great. Send me all your friends.
Absolutely. I have several of them I've already recommended to you. And if I ever have to have my bunion done, which doesn't bother me now, I will do that.
Well, thank you. You've been a great